So I will jump into the award. So the Patty Brown Innovation Award honors individuals or teams transforming Maryland's healthcare landscape. Winners demonstrate innovation by engaging and collaborating with stakeholders across the healthcare industry. They show strategic vision, leading others in deploying practical health IT solutions, and above all, their work aims to improve health outcomes for patients and communities. This year, we are proud to announce that the award goes to Hamden Health Solution at the Rail, continuing the tradition of recognizing outstanding achievement. Hamden Health Solution at the Rail is a private organization under BD Health Services that provides outpatient treatment in Baltimore, catering to adults and young adults facing substance abuse disorder and offering those afflicted by substance abuse counseling, care coordination, case management, and home health care. Their mission is to consistently deliver patient-centered care for individuals managing substance-related health challenges. In their care coordination efforts, staff facilitate care across varying health facilities and patient needs. They leverage CRISP to access overdose notifications, access patient medical records, and the prescription drug monitoring program. This ensures patient-centered care encompasses substance abuse treatment as well as physical and mental health. Building on these efforts, Hamden Health Solutions formed an innovative partnership with the University of Maryland and the JOCS Institute to expand on-site access to rapid STD, HIV, and Hep C testing. Through this partnership, JOCS provides a weekly on-site nurse for diagnosis, information, treatment, and Hep C medication, increasing access for most in need. CRISP selected Hamden to showcase how organizations collaborating and leveraging complementary expertise can centralize beneficial services for patients in one specific location. I will now play our interview so you can learn a little bit more about Hamden and that unique collaborative partnership with the University of
My name
Maryland.
is Rachel Broyles. I am the program director of Hamden Health Solutions at the Rail. I'm also the program sponsor, and I also work at Bel Air Health Solutions. It's underneath the BD Health company. So we are essentially a medication-assisted treatment facility, outpatient treatment. We have methadone and buprenorphine. We provide substance abuse counseling, coordination of care, health homes care, case management, things of the sort. I think our actual specific mission statement is to provide the best possible person-centered care within a haven of caring and support. And that really essentially just comes down to what we really do at the end of the day is that we help people and we listen and we care. And in caring, we also want to do a lot of coordination of care. And that's the beautiful thing about this initiative that we're doing with Jacques Initiative is that it's all in one place. It's all combined and it's all for the benefit of the client. And I'm sorry, I did not introduce our other, we have our wonderful medical director, Dr. Kat. She's been with the company since I believe 2019, I think. Yeah.
Yep. I started like 2 weeks before COVID officially. I just
Nice.
will remember that for the rest of my life.
We also have Jacob. He's an assistant medical director.
Yeah, hi, good morning. Thank you, Rachel.
And then normally we work with a wonderful NP by the name of Genevieve. She is currently, as you know, on maternity leave. I'm not familiar with Miss Davy, but if you would introduce yourself.
You're stuck with me today. I am JOCS Initiative Program Director. I've been here at JOCS for about a little over a year and a half. I have very big shoes to fill today, filling in for Genevieve Beninati, our awesome nurse practitioner who is on parental leave right now. And we are just so happy to be part of this collaboration.
Awesome. Well, thanks so much for joining today. You guys mentioned in the intro about care coordination and the kind of responsibility of helping assist with the care kind of all over the place for these patients. Can you tell me a little bit about those efforts and then just how CRISP might fall under some of those? How does CRISP support that work?
Would either of the medical individuals like to take that?
Sure, I can jump in for some big picture ideas. In general, the clients that come to us, their lives can be very chaotic. We may be the only medical facility that they are seeing on uh, a regular basis. You know, they come in, they get their medicine, and now with extended take homes, maybe once a week, once or twice a month instead of every day, but we could be the only people that they actually touch. And it is not at all uncommon for them to come in and not know their medical issues. They don't know what potentially the meds they're on or different diagnoses. And using CRISP, we are able to access their medical records from other people, from other physicians. We're able to see that they potentially are hepatitis C positive, but have never gotten treatment for a variety of reasons. You may or may not be aware, but prior to, don't quote me on this, I think 2020, it was very difficult to get people with hepatitis C treated across the board unless they had later stages of hepatitis C, like fibrosure 3 or 4. So that's severe disease. And we also would have to prove to insurance companies that they had stability in their lives, that they would be able to take their medicine. And then some insurance companies wouldn't even treat patients if they were still using because they were as a fear of reacquiring hepatitis C. Now, general, it's much easier. Insurance companies are treating people left and right. So a lot of patients know they have hep C, but they're like, oh, I don't qualify for treatment. But we're able to close that gap. So that is one way that we do help patients almost help translate some of their medical issues. Now, we also have a health homes nurse that for those who qualify, and it's more of an insurance dependent, I believe Jacob can probably correct me there. We're able to assist getting them into specialists and primary care. And we're able to see, for the most part, using the CRIS database, if they made it to those places and get, of course, get those documentations as well. Those are our two major sort of care coordinations, I believe, that we're using right now. The other way we use CRISP is, unfortunately, our patient population does have a higher risk of overdose. We're able to access medical records and from hospitals, and this is important. For the non-fatal overdoses, we want to see what happened there. Was it because they're still using fentanyl? Well, that is that changes our approach. That means, hey, maybe they need a higher dose of methadone. Maybe they need more touch points within our center, which we do. If there was a non-fatal overdose because of other issues, maybe benzodiazepines or a combination of medications that are being prescribed by other physicians, well, that will also change the way we approach that as far as their medication dose. That may mean we need to lower it, but all that is a patient-centered discussion. Sometimes, patients just say, "Hey, I was in the wrong place at the wrong time and I just used." Okay, so that's why it is so important that we get that feedback pretty quickly from CRISP. Get the notifications of potential overdoses in the hospital, so that we're able to meet with the patients and help safely figure out what's the next best step for them. Jacob, did I miss any other care coordinations that we've got going on?
I don't think so. You mentioned health homes, so our health homes nurses use I think it's called SEND, SCEND. Those are like the automatic CRISP notifications that come to the health home nurses to check if any patients have been hospitalized. So they are able to view that information, export it, upload it to patients' charts, and then they know to see the patient next time they're back in the clinic to follow up on any hospitalizations, make sure that patients understand, why they were hospitalized and what they can do to hopefully prevent that from happening again.
That's great. I think the CRISP tools definitely are beneficial then in your use case, just to be able to see all those outside procedures, get those alerts, and then see any overdoses. So that's awesome. You mentioned Hep C in your answer, Kate. I want to kind of connect this to the initiative that was mentioned. So tell me a little bit about the testing efforts that is with your partnership with the University of Maryland. What's the project's background, goal, origin, and current status?
Sure.
I can at least go for the current status. I do know that. I'm not sure about the background. I'm sure Ms. Davy has more information on that. But I do know that through across all 6 BD programs that we have, including Hamden Health Solutions, we have been usually it's about once every 3 months. We have individuals from Jacques Initiative come in. They're on site. They're there. They're in the lobbies. They're engaging with the clients, and they're offering on-site rapid testing for HIV, different types of things, Hep C, of course. Of course, at Hamden Health Solutions, the beautiful thing about that place is that with coordinating with Genevieve, they can also get Hep C testing any day. Our wonderful phlebotomist, she draws the blood, and then she'll drop it off at the appropriate center, like lab, or they get a courier pick it up. And that way, Hep C testing is always available and like on site for them. Would you like to go over the background?
Sure. First, I'd like to say that Jocks Initiative has over 2 decades of experience with engaging hard to reach populations, disproportionately disadvantaged populations rather. So this work is it ties into our overall mission and vision. So what we strive to do is create low barrier medical settings where people can get the care where they need, essentially meeting people where they are. So establishing the community clinical sites as we've done, here in this project has allowed us to create an environment where people are able to access care literally right where they are. So having that nurse practitioner there, Genevieve there to provide care, having that telehealth option to provide care, and then having our community outreach staff to provide screening. I did come prepared with some data. We were able to test about 76 people for HIV and about 48 people for hepatitis C. And we were able to actually link about 11 people for hepatitis C treatment, and 2 individuals are actually cured. And if you're familiar at all with hepatitis C treatment, it's not one and done. It's something that you need to keep that person engaged because you need to have that sustained virological response in order to even be cured. So that is awesome. This initiative reflects collaboration. It reflects innovation. It reflects persistence. It reflects outreach. And these are just all the great things that encourage us to keep our collaboration and our partnership with BD Health. So
Those are great data. What was the time period of that? I'm sorry if you mentioned.
yes, it's from the beginning of the program, which precedes me at Jocks, which was in 2024,
Hmm.
Pat. Yeah, around May 2024.
Yeah, I was trying to think
Yes.
back too. Yeah.
Yes. Mm-hmm.
Awesome. And then in the kind of process of that, so you have an on-site nurse come weekly. I guess what was the thinking about the frequency of that, and talk to me a little bit about the thinking of having an on-site person there.
Yeah, I can jump in. I do want to piggyback on a couple of things. As Shakima said, the medicine is not one and done. To treat hepatitis C, it's usually a 2 to 3 month course of daily medications.
Mhm.
So it's very common for patients to get lost to care, their addresses change. So that's why having this touch point is good for patients. And a little bit of the background of how this all got started was Dr. Spison is a personal friend. She's actually a neighbor of mine. She runs I don't know her actual title is, but the HIV directive of Jacques. She had approached me because she knows BD. We do a lot with different organizations. We try to be very innovative and creative with how we can help the most people. And she just asked if we would be interested in doing this. So it's sort of that personal connection because within the opiate use disorder world, it's a very small community of us
Mm.
physicians and people that are interested in doing this work. So sometimes these cool initiatives come out of just, having coffee with someone and saying, hey, like, would you guys be willing to do this? And I'm really proud to say BD is usually we usually say yes because
Mhm.
because maybe we're a little crazy. But to answer your specific question, why once a week? In the previous nurse practitioner that works for BD, who does the medical uh, uh, prescribing of methadone, she was only there 4 days a week. So Thursdays was her day that she wasn't there. I believe she did telehealth from home. So we had an office space for her. It was just a very
Mhm.
practical, there was an office for her. Now people can get tested any day of the week because the
Right.
phlebotomist is there, but then meeting with the actual provider is on Thursdays. I think that's what it still is.
Yes.
That does, there are some issues with that because patients don't come every day. Clients don't come in to get their methadone every day. So if they come on Wednesday to get their dose, it's kind of hard to convince them to come back the following day if they don't
Right.
need to come back for a week. But we've been hopeful that, when they know they can just come to us to get treated, that might be motivation to come back down. But I would say that is definitely a drawback for only
Mhm.
once a week.
Yeah. Well, I love the story too about the personal connection because I think a lot of the great ideas that kind of spurs like a lot of things that CRISP does is from, people telling us like, hey, we have this issue, like let's work together on that. So I appreciate that story. Um, I want to talk a little bit about uh, any future initiatives you have, or even some additional things you're focusing on with this partnership. Is there any goals or plans that you want to kind of share for the audience about what's next for Hamden?
Well, I would say in general, before Genevieve went out on maternity leave, there was sort of talk about her going to all the different clinics. We have 6 BD clinics within Baltimore, 5 in Baltimore, 1 in the county. And she was willing to physically go to these clinics. Maybe we'll readjust that when she gets back from paternity leave. But expanding it to the different clinics was one thing that we were considering.
Hmm. Jacob, Rachel, anything come to mind?
Well, I know definitely the one thing that I always try to look for is continued coordination of care, especially in this population that we serve. Like was mentioned before, there are a lot of barriers to treatment, and that includes things like transportation, location, and availability of providers. But also, it's not easy. Some of our population may be homeless. They may not have any other place to go, any motivation to go and work towards um, fixing their physical and mental health, whatever the case may be. I mean, we try to do a lot of like case management with several domains such as like housing, employment, physical health, mental health, legal. So it's always really important to whatever resource we can bring into the actual program itself, because we know that they will attend the program. And if that care is already there, that eliminates so many barriers, motivationally and otherwise. And having someone there to, just first check on them. That's one of the things that Genevieve was amazing with. Yeah, she was only there on Thursdays, but this woman was always, after the proper ROIs and whatnot, she was always calling everyone, checking up on everyone,
Mhm.
making sure that they were happy that they're getting their treatment and whatever the case may be. And that is such a huge thing to anyone, yet alone those that may not have anyone else that does care in their life.
Mhm.
So of course, our main goals are always to look for new ways to bring more of like Dr. Kat's wonderful initiative into the program. And I mean, obviously, I would love to see every single program that we have in the Baltimore area have a Genevieve. Um, but in terms of like other programs, it would be wonderful to bring even more resources and individuals from, say, like mental health care providers, other like maybe primary care doctors, or even, just once a week, having someone there in that lobby to showcase the importance of their physical and mental health and how everything is related and correlated. That's what I always want to work towards. I want to bring more access to the treatment that they need, because substance abuse is not just using a substance. Substance abuse is every facet of someone's life.
Mhm.
So you can't just treat, the substance abuse issues. You have to treat, do they have safe housing? Do they know their physical health ailments or issues or treatments available? And a lot of times they don't. So I really want to bring that into the program for like a whole treatment facility in terms of the domains.
Thank you for that, Rachel. And Dr. Cat, we remain committed on behalf of Dr. Spison and Genevieve. We remain committed to this collaboration, this partnership, because this is the very heart of, the work that we do to improve the health outcomes for these vulnerable populations. And on behalf of JOCS Initiative, I want to just congratulate you again, Rachel, on this Chris Patty Brown Innovation Award. Congratulations.
Thank you very much. That's really, it's everyone here, honestly. I mean, Dr. Cat, if it wasn't for that cup of coffee, we wouldn't have it. So greatly
Oh,
appreciate
yes.
Mhm. Well, awesome. Well, thank you guys so much for sharing your time and your story. I think this will be super valuable for our participants to hear about the great work that you do, and we couldn't think of a better organization to provide this award to. So, thank you so much, and congratulations. And hopefully, this can spur the audience to reach out and connect and continue to do great work in the future.
Thank you.